A patient I see sometimes came to my office recently. He's 26 years old. He was in a long relationship for several years. That relationship ended some time ago. Recently, he started a new relationship. He told me he is very happy. And this relationship feels serious to him. They have now been together for about 3 months. And in the past, he would sometimes come to my office for routine testing just to make sure everything was fine. This time, he came with a very different concern. He said, "Doctor, I did the herpes blood test. The results says I have herpes type 2. I never had any symptoms on my genitals. I never had sores. I never had blisters, nothing like that. But now I'm worried. I'm in a new relationship. Things are going really well. And now I don't know what this result means. Did I get herpes recently? Did this come from my current partner? Does this mean someone cheated in the past? And honestly, I'm scared because I read online that herpes never goes away. So does this mean my life has changed forever?" Situation like this happen very often. Someone decides to get tested, sometimes because they're starting a new relationship, sometimes because they want to be responsible with the partner, and suddenly the blood tests come back positive. But here is a confusing part. The person never had symptoms on the genitals. No sores, no blisters, nothing. So it feels like the answer must be obvious. If the test is positive, something must have happened recently. But medically, it is often not that simple. My name is Dr. Slava Fuzailov. I'm board certified internal medicine physician working with STD Center NY. In this video, I will explain you several things. What the positive herpes blood test really means, why many people with herpes never notice symptoms, what this test can and cannot tell us, and what people should actually do with this information. Let us go step by step. The first question patient asks is this: did I get herpes from my partner? The honest answer is that no one can tell that from this test. A positive herpes blood test does not show when the infection started. There are two possible explanations. Yes, the virus could have come from current partner, but it's also very possible that the virus was already there long before this relationship. Many people only get tested because partner was diagnosed, so the test feels like new information. But the infection itself may not be new. That is why this test cannot prove when the infection started and who transmitted it. The next question people ask is this: if I have herpes, how could I not know? Many people believe herpes always cause obvious sores, but in reality, most people with herpes do not notice symptoms. Studies show that about 80 to 90% of people with genital herpes do not know they have the infection. Only small minority of people develop clear and recognizable symptoms. Sometimes symptoms are so mild that people think it is a skin irritation, a small cut, an ingrown hair, or simple friction. So a person can carry the virus for many years and never realize it. That is why a positive test results often surprises people. Now the next question patient usually asks is this: can I trust this blood test? In my practice, I usually do not recommend herpes blood testing. Most of the time, it's only done because a patient specifically asks for it. There are several reasons for that. First, the test is not perfect. Sometimes the test can give false positive result. That means the test suggests herpes, even though the person may not actually have the herpes. Second, false positive result can create a lot of anxiety. People start worrying about their relationship, they worry about their future, they worry about how this might affect their life. But the result may not actually represent a real infection. Third, in many cases, the result does not change what we do medically. Treatment for herpes is usually given only when someone has symptoms or when someone has frequent outbreaks. If someone has no symptoms, there is usually nothing to treat. So the blood test can sometimes create worry without changing treatment decisions. Many patients then ask another question: should I repeat the test? Usually the answer is no. Repeating the same blood test often does not solve the problem. If the result is truly positive, it will usually stay positive. And if the first result was false signal, the repeat test may still show the same result. So repeating the test often does not remove the uncertainty. Now, the next question patient asks is this: what is the virus in my body? The blood test cannot answer that question. It only shows that the immune system has seen the virus at some point in the past. It does not show where the virus is located. The type of virus, type 1 or type 2, is identified by lab test, but the location of the virus is understood differently. We understand the location by looking at where symptoms appear. If a blister or sore appears on the mouse, the virus in that area. If the symptoms appear on the genitals, then the virus is located there. At that time, doctor can take a swab test from the sore. A swab test means a small sample is taken directly from the lesion with a soft cotton tip. The lab can confirm that it is herpes and identify the virus type. Without symptoms, we usually cannot determine the location of the virus. Now, let's talk about another common misunderstanding: herpes types. There are two main types of herpes virus, type 1 and type 2. Many people believe type 1 only affect the mouth and type 2 only affect the genital area. But in reality, it's not that strict. Both types can appear in different places. Type 1 can cause cold sores around the mouth, but it can also cause genital infections. Type 2 most commonly affect genitals, but sometimes appear orally as well. There is also important social issue around herpes. Many people feel comfortable if they hear they have herpes type 1, but they feel very anxious if they hear herpes type 2. The reason is mostly social stigma. Type 2 is often called genital herpes, so people immediately think it must be a sexually transmitted infection. But medically, the situation is more complicated. Both viruses belong to the same family, but can infect the mouth, and both can infect the genitals. So the type number alone does not always tell us where the virus is located. Another situation I hear very often from patients sounds like this. They say, I know I have herpes type 1, because I used to get cold sores on my lips. I had them since I was younger. So I always assumed that was type 1. But now my test says I have type 2. So this must be something new. But that assumption is not always correct. A person may have carried type 2 for many years without knowing, because they never had symptoms and never had testing done to identify the virus. No swab test and no blood test. So the infection could have been there long before they ever checked. Now let us talk about how common these viruses actually are. In the United States, about half of the adults carry herpes type 1, and about 1 out of 8 adults carry herpes type 2. Many people who carry these viruses never notice symptoms. Now patient asks another practical question. How could I pass this virus to my partner? Many people ask this because they want to be responsible and ethical with their partner. They want to understand what they should and should not do to reduce the risk of transmission. Herpes spreads through direct skin-to-skin contact. The virus spread from the place where it lives on the skin. If the virus is on the mouth area, it can spread during the oral contact. If the virus is on the genital skin, it can spread during sexual contact. So the virus spreads when that area of skin touches another person's skin. But here is a challenge. If someone has never had symptoms, we usually do not know where the virus is located. It could be oral or it could be genital. So we cannot always say exactly how transmission might occur. If symptoms appear, the place where they appear tell us the location. Then swab test can confirm herpes and then identify the type. Now let us talk about treatment. Patients often ask, do I need medication? Usually the answer is no if there is no symptoms. When I treat herpes, it's usually because someone has clear outbreak. Medication can reduce symptoms and lower the chance of spreading of the virus. When I wait is when there is no symptoms to treat. Many people with positive blood tests never develop noticeable outbreaks. If symptoms appear later, then we reassess the situation. Another question patients often ask is about future partners. Do I need to tell future partners that I tested positive for herpes? From medical perspective, open communication with partner is usually the healthiest approach. But there is something important many people do not realize. Herpes viruses are extremely common. Many adults carry them. Many people never have symptoms, and most people have never been tested. One reason is that routine blood testing for herpes is not usually recommended in people without symptoms. So many people simply never know their status. What often happens is that someone gets tested because of specific situation. For example, because a partner was diagnosed. So that person suddenly has information that many other people never checked. Understanding this context can help reduce unnecessary guilt and fear. Now let's come back to the biggest fear people have. Many people think a herpes diagnosis changed their life forever. But for most people, herpes becomes a manageable and often minor medical condition. Many people live normal lives. They have relationships, they have families. And most of the time, herpes becomes a small part of their health history rather than a major life problem. So here is the most important takeaway. A positive herpes blood test does not tell us when the infection started. It does not prove who transmitted the virus. And it does not show where the virus is located. Many people carry herpes without ever knowing it. Once patients understand this, the situation usually becomes much less frightening and decision becomes much clearer. If you like what we discussed here today, and if this video was helpful for you, please like this video, subscribe to our channel. It helps our channel to grow and give us energy to continue making more videos like this.